Hi,
Hi.
it's Purana Talk again.
Surprise.
We're the Purana guys, Alan,
Alan,
Leon.
chapter 162.
We're exploring diseases in the Garuda Purana.
Yeah, this is Garuda Purana, part 1, chapter 162. Diseases, in which Dhanvantari, the lord of Ayurveda, speaks to Sushruta, author of the Sushruta Samhita, I guess. I think that's right. One of the earliest Ayurvedic texts. And we have a complete text of medical diagnosis. It's
Sorry, it was tipping over. So
really?
like, yeah.
Oh, I liked it before. Now we're down at the bottom. Okay, it's okay. Look, this isn't going to make it any more interesting.
Oh, are you sure?
I'd like to think. All right, yeah. What I'm saying is, I mean, this is a whole effing text on Ayurveda, and it goes on, and it's specifically diagnostic. Um, and
So imagine it's like
old
poetry. It's all in rhythm.
Yeah, they're kind of
There's sometimes internal rhyme structure and stuff, but what really matters is that it's memorable.
It's like a medical text in rap.
Right. Yeah. That's a good metaphor, I think. That's accurate.
The rap of its moment.
And it goes through a whole bunch of things. This is just one of the things it goes through. Anyway.
And right now it's going through diseases.
Yeah.
Interminably.
So the trick is to guess what the disease is.
Yeah.
Yesterday it was swelling.
Well, was it?
And what did we decide? It was like
ascites.
Asces, right?
Ascites, it turns out, was closer to the correct pronunciation than ascites or something.
And it was
Cites.
What's the Western name?
Well,
for it?
One form of what they're talking about is cirrhosis, and
cirrhosis of the liver.
And
right?
when we Googled it, we saw a picture that really showed how it was talking about the swollen stomach covered with a network of veins like a window.
There were different colors,
and there was a picture. Mm-hmm. So
accurate to some degree, anyway.
So as morbid and kind of nauseating as some of the text is, I don't know. It's still very interesting.
But it's down and dirty. It tells you what really is going to happen and stuff like that. So.
All right. Chapter 162, Diseases. Dhanvantari said, "O Sushruta, I shall tell you the pathology of Pandu and that of Shota." Fortunately, there are parentheses. Pandu, it says, is chlorosis and jaundice. Chlorosis being CHLOROSIS, and jaundice. And the other is Shota, which is edema, and anasarca. Well, that clarifies things. Anasarca. Edema and anasarca. And edema is swelling. We've already had forms of edema.
Well, edema is specifically water weight gain, where the test for edema is you push with your thumb onto the skin anywhere, mm-hmm. and count to 10.
Okay.
And lift your finger up, and if it's still white after 3, you've got edema.
Okay. I thought you were going to tell me it was like dough. You can tell it's rising.
Well,
your thumb
it'll leave an indentation, but how quickly the blood can get back into it tells you how much water there is.
Okay, I'm going to take it away again from the top.
Yeah.
O Sushruta, I shall tell you the pathology of Pandu and that of Shota. All the morbid humors with Pitta as their leader become aggravated due to various exciting factors mentioned before. So Pitta is the leader of humors that become aggravated in this particular condition, I guess.
Okay.
Maybe. I mean, you can see that it's Pitta-ish in the sense that we're talking first about the color yellow, which is like, mm-hmm. Pitta virtually means yellow, and bile and things like that are associated with pitta are, thought to be yellowish. And we're also talking about edema, which is water retention. So what the other thing about pitta is that it's wet. It's wet, it's yellow, it's also warm.
Well, what I thought of is jaundice is often liver, and edema is often kidney.
Right. Okay. We'll get through this first stanza yet. Actually, we already did, didn't we? All the morbid humors with pitta as their leader become aggravated due to various exciting factors mentioned before. 2. The more powerful of the doshas lead them on and toss them about all over the body. Finally, when they come to rest, they permeate all the 10 dhamanis, 10 nerves. It's called dhamanis. 3. The kapha, skin, blood, and the flesh are defiled. Different colors are given to the skin. 4. Among the colors, the color of yellow like turmeric is predominant. Hence the ailment is called pandu. I'm not quite sure how that follows, but there's something in the etymology maybe of pandu that tells us. A sort of heaviness of the body is caused by vayu, wind principle. In the amaja type, where much matter is present, the main constituents, dhatus of the body, lose their consistency and become lighter. The patient becomes deficient in blood, anemic. The quantity of fat is diminished. The bones are not substantial. The sense organs do not function properly. 6. The limbs get thinner and thinner. Clammy sweats exude in the cardiac region. Pain in the eyes, rigidity in the face, and salivation are observed. The patient does not feel much thirst. He abhors chilliness. With his disheveled hair fluttering in the air, he patiently suffers from fever to equal intensity. From fever of equal intensity.
Yeah, well, I think what they're talking about is where the person will get cold and then hot, cold and hot, alternate. They'll go through chills and fever.
Okay. He coughs, has pain in the ears, and has vertigo. 8 to 10. The ailment is of 5 types, 4 of them being caused by the doshas severally and in combination, and the 5th by eating earth.
Ooh. All right.
Well, maybe there's a germ theory or something, actually the idea of consuming a contaminant as opposed to your doshas by other devices, getting out of balance. But I don't know. Eating dirt. Krishna ate dirt.
Yep. And he got the universe inside him. So.
His mom got a surprise when she looked in his mouth. Okay. 8 to 10. The ailment is of 5 types, 4 of them being caused by the doshas severally and in combination, and the 5th by eating earth. The premonitory signs are perspiration in the region of the heart, dryness of the skin, non-relish for food, scanty yellow urine, and absence of perspiration. The vayu causes a stupor, excruciating pain, wetness all over the body, a sort of black or vermilion color, and dryness in the veins, nails, eyes, feces, and urine. Intumescence, dryness of mouth and nostrils, scantum of feces.
Not much.
Scantum?
Yeah,
it's like they've Latinized.
Yeah, I don't know.
Not much. And numbness in the sides. Wait, it gets better. I've already said that once, didn't I? 11. The pitta causes greenish or yellow color in the vein, etc. Fever, vanish of vision of light. Parenthetically, darkness. Thirst, emaciation of the body, swooning, foul smell, fondness for cold things, and bitter taste in the mouth. 12. The kapha, that's what the pitta causes. 12. The kapha causes diarrhea, acid, erectations, burning sensation, clamminess of the cardiac region, lethargy, saline taste in the mouth, horripilation, and aphonia.
Horripilation being when you get goosebumps or your hair stands up.
We may have explained that already too.
Yeah, I'm not sure.
We may explain it again.
It
gets used a lot in here. What was that?
It was something changing shape. I'm not quite sure what.
All right. 13. Cough and vomiting. The symptoms of a combination are very unbearable. The mucus expectorated is either bitter or sweet due to the prevalent vayu or pitta. 14. The defiled kapha vitiates the fat and other vital constituents of the body, and generating a condition of parchedness causes even hemorrhage. As said before, it may obstruct the various ducts and vessels of the body, resulting in general debility. 15. In jaundice, the navel, feet, face, and the penis become thinner and thinner. The feces are infested with germs. Loose and mixed with blood and mucous matter, the patient affected by jaundice continuing to eat pitta-generating foodstuffs is afflicted by kamala, chlorosis. The pitta, coming of its seat in the abdominal cavity, scorches up the blood and the flesh. 17. The color of the urine, feces, eyes, mouth, and the face becomes yellow. The patient feels a burning sensation, indigestion sets in, and the patient lies like a bloated toad, weak in all his limbs and organs of sense. You'd kind of like to hear that done in rap, wouldn't you? You know, I mean, it's got to be a different experience to have a...
It totally is. And you can hear it on YouTube if you just put in that you want to hear chapter 162 of the Garuda Purana.
Yeah, there's a whole
Sanskrit.
There's a whole series.
They have it there, and you can just
some guy is chanting it. 18. The unabsorbed pitta of the jaundice patient gives rise to a kind of swelling, and when these swellings are neglected, the dreadful ailment of Kumbha Kamala sets in.
Isn't Kamala a goddess?
Kamala is a goddess. It is from lotus. Well, this has a first long A, so it's a little different. It's Kamala. Okay. So it might actually have more to do with Kama. And La is sort of a suffix that you find certainly in Tibetan honorific names and things like that. So it might be related to... And Kumbha means pot, like Kumbha Mela, like Kumbha Aquarius, right?
Right.
So Kumbha Kamala is a dreadful ailment.
I'm sure it is.
If it hasn't already described it and we've forgotten about it, it'll probably describe it.
It mentioned it earlier.
Yeah. 19. The unassimilated pitta produces greenness of complexion. The vayu and pitta in combination produce vertigo, thirst, desire for the company of women, and slight rise in temperature. 20. Moreover, there may be somnolence and impaired digestion. Sages call it halimika. A great lassitude is also observed. All these are the premonitory symptoms of this disease. Shota, edema, has already been mentioned as a grave ailment, hence it is being explained. The defiled vayu takes the contaminated blood, pitta, and kapha to the external vessels and gets obstructed in its path, generating a raised and compact swelling of the local flesh and skin. This is called shota. Shiva, Sotha, if you're wondering how
I'm trying to do halimika.
You're still doing... Where is it? What? Oh,
halimika.
Halimika. Yeah, Hal long I Maka. Halimika.
Okay. And what was the one you were wanting me to get?
Well, shota is this edema, so...
Oh, yeah, I got that already, actually.
Shiva, Sotha.
Right there at the beginning.
The dental aspirate.
Yeah.
Okay. Where are we now?
My last note was 20.
Shota has already been mentioned as a grave ailment, hence it's being explained. How about this? 2324. This ailment is divided into 9. Shota is the edema. Is divided into 9 according to the causes. The 3 doshes separately in combination of 2s, all combined due to attack and due to poison. There you go. That's how you get to 9. To rewind that and listen to it again a couple times.
I get the idea.
It is divided. It is divided into 3 in accordance with their shapes. 1, large. 2, raised and pointed. 3, knotty. Knotty. You know. They may be congenital or acquired. They are spread all over the body. They are necessarily generated by overlustfulness. A common cause of all types of shotas is the deranged morbid humor. Not a deranged morbid sense of humor.
Well, I might bring it on, but
it's
not the cause exactly.
It's really a different thing.
Yeah.
Okay. But, yeah. They are found in persons. We got to get some fun out of this. They are found in persons emaciated due to sickness, overwork, fasting, etc., rapidly growing. In case of others, the intake of foodstuffs in large quantities, especially such as are heavy, too cold, saline, acid, or alkaline, green vegetables and water, or excessive sleep or wakefulness may cause shota.
So, in other words, they have no idea what causes this. They're guessing things.
Well, it was a bunch of foods, and then all of a sudden, man, too much sleep or not enough.
No, they don't. They're not sure. They wouldn't give you a list like that if they knew what was causing it. But
doctors haven't changed much.
When you think about jaundice and edema, there's a bunch of things that could cause either of those things.
Yeah.
It's surprising in the jaundice case they haven't connected it to alcohol use like they did in that other chapter. Remember, they had that as an idea already.
Yeah.
So it's surprising they haven't connected those things, but maybe they don't understand what's happening in that way.
2728. The voluntary suppression of natural urges, eating dried flesh, indigestion, exhaustion, sexual intercourse, traveling by foot or in a jolting vehicle, all these aggravate these diseases. Dyspnea, cough, dysentery, piles, ascites, leukorrhea, fever, tympanitis, flatulence, vomiting, hiccup, erysipelas, and jaundice. The morbid humors lodged in the upper, middle, or lower parts of the body, shota, generate shota. Excuse me. The morbid humors lodged in the upper, middle, or lower part of the body generate shota, edematous swelling in their seat or in the urinary bladder. 30. Its premonitory symptoms are burning, pain in the nerves, and heaviness of limbs. In the vataja type of swellings, they are found to be shifting in their character, rough, blackish, or reddish in color, and have rough hair around their base. 31. The patient complains of breaking pain in the temples, bladder, entrails, etc. Due to the pain, he is unable to sleep. The swelling grows rapidly and the whole body is painful. The swelling is small during nights and grows large during the day. It is glossy. By pressure it may subside. If mustard is applied over the swelling, a tingling sensation is experienced.
All right, I want to take note of that, mustard therapy.
It doesn't exactly explain whether you're using like mustard oil or ground mustard.
What verse was that?
French's
32.
32, yes. The swelling is small during nights, grows large during the day. It is glossy. By pressure, it may subside. If mustard is applied over the swelling, a tingling sensation is experienced.
And mustard plaster like that is used as drawing. It draws out and it heats.
Yeah.
So it can bring to a head and make things pop and things like that if there's infection under the skin. So this is what they were thinking, I think.
33. The Pitta type, derived of Pitta, born of Pitta, type of swelling is black, red, or yellow in color. It produces shosha, which is different from shota. Shosha is emaciation. It does not subside quickly. Before the advent and in the middle, it gives a burning sensation all over the body. Fever with thirst, burning sensation, and perspiration, vertigo, pain, stupor, yearning for things, loose motion, foul smell, and softness to the touch are characteristic symptoms. In the Kapha type, the swelling gives an itching sensation, has yellow and gray hairs, is hard-skinned, cold, firm, glossy, smooth, and painful. It produces sleep, vomiting sensation, and indigestion. 36. A blow, a cut from any weapon or any hard thing, exposure to chill winds or sea breezes, or the juice of balatika or kapikachu fruits may produce a swelling with erysipelas. And those would be the Somacarpus anacardium, and perhaps, in the case of the kapikachu, perhaps the same as the Swayamgupta, or the Mucuna-pruriens.
I do not know these references, however.
No. A couple of fruits. I'm going to read that again. A blow, a cut from any weapon or any hard thing, exposure to chill winds or sea breezes, or the juice of balatika or kapikachu fruits may produce a swelling with erysipelas. It is marked by extreme heat and exhibits symptoms common to Pitta type. It is red in color. Swelling due to poison is caused by poisonous insects and reptiles when they pass over the body or urinate there. Even when...
Where are we now?
38.
Okay.
Even when non-poisonous insects and animals bite or scratch, swelling may occur. 3940, the final section, when one comes into contact with a cloth contaminated by feces, urine, or semen, or when one comes into contact with breeze coming from poisonous trees, or when one grinds a poisonous medicine, a swelling may occur that is soft, shifting, hanging loose, and extremely painful and burning. A fresh swelling without disorders can be cured, but not a chronic one.
Yeah, well, especially if you haven't figured out what's damaging the kidneys or what's damaging the liver, or still works that way.
So, sleep tight, or have a good day wherever you go, whatever you do.
Enjoy it.